Sources are telling Fox Business that Senate leaders are planning to meet with President Trump as early as Tuesday to present a draft of their health care bill. Joining me right now with his thoughts on all of it, whether or not it's going to happen, and it needs to happen, Washington Examiner senior political analyst Michael Barone. Good to see you, Michael.
Hey, good
what
to
are
see
the
you.
odds on this one?
Well, I think the odds are a lot better than conventional wisdom is thought. What we're hearing from Mike Emanuel at Fox News is that the Senate Republicans are talking about differences in Medicaid coverage and when it's skinned back. In other words, they're arguing about numbers. And numbers are something you can compromise on. If one side wants 7 and one side wants 3, you're probably going to end up, if they're still talking, around 5. The other thing that's important here is that the congressional, the Senate parliamentarian has ruled that the provisions of this bill are subject to the procedure which allows it to pass the Senate with 51 votes.
All right. So what do you think's going to happen, though? I mean, are they going to just rely entirely on the Republicans? It sounds like Donald Trump's not getting any support at all from Democrats, and there is a sense in Washington among Republicans that, gosh, you know, darn, if they can't get this done, then forget it. You might as well go home.
Well, the fact is, health care, going back to the beginning of the Obama administration, has been a monopartisan issue. The Democrats didn't have any Republicans involved in any way, shape, or form in the sculpturing and sausage-making process that was involved in Obamacare, and now the Republicans are in their sausage-making process and sculpting process, and they're not involving the Democrats. And, you know, since the Republicans are saying we want to get rid of this law that the Democrats passed, which is not a good law,
right?
You can kind of understand the Democrats' point of view.
And that's
so the answer is
challenging.
the answer is that I think that your second point is germane here. Voters will reasonably say to the Republicans, look, you promised for 6 years you were going to repeal or replace or reline Obamacare.
Time to do it.
And when you had majorities, you couldn't do it. That's
let me ask you, Michael. You heard Lindsey Graham there. He's talking about potentially putting 10% of the population that's really, really sick in some kind of subsidized type government program and then let the private market work for everyone else. Are you worried at all, though, that that leaves the very, very sick at a very, very big disadvantage?
I think that that's not what Lindsey Graham was talking about was a pipe dream, and if it had any rational purpose, what he was maybe doing was saying to Republicans, look, we better reach agreement because this sort of thing is going to be totally unaffordable. It's going to be totally unmanageable, unadministratable, and if you want to turn us over into a socialized medicine country, just keep being a purist on this issue.
Real quick, because I just got 30 seconds, but are we going to see something really by 4th of July holiday?
I think there's a better than 50% chance on that, and I wouldn't have said so last week.
I like that. All right. Some optimism there from Michael Barone today. Thank you, sir.